Joining me now is Congressman Dave Joyce from Ohio, a state that's been hit particularly hard by the opioid epidemic. He's the vice chair of the Congressional Addiction Treatment and Recovery Caucus. Congressman, it's great to see you again. Look, I always like to start these discussions when we're discussing opioids, treatments, and what we do to kind of become a better, healthier society with real people. And I just love our audience to know why this issue is one that you've taken such an important leadership stake in Congress, what it means to you, like what got you into this important track.
Well, before I got here, I was a prosecutor for 25 years. And during my time as a prosecutor, obviously you'd see drugs come and go, but there's not one drug that's had a worse effect on the American people than the opioids and then introduction of fentanyl and all these other things into the addiction system. And I watched people, unfortunately, addicted, watched people dying, and watched how it permeated society. It showed no lines between race, color, gender. It just didn't matter. And unfortunately, it was something that I was shocked at. And when I left and I got here, I wanted to use my influence, if you will, from my time as law enforcement to sort of put together and help craft a package that would deliver results. Because the unfortunate part is it's just devastated some communities throughout Ohio.
Well, it's something I hear a lot about from legislators. What I don't have a sense of is both in Congress and in the Biden administration, I suppose, what is the DEFCON level among your colleagues? Do they understand how serious this is? And do they have a sense that, the policy proposals you and your colleagues in the caucus are putting forward really need action now?
Well, that's a great question. I don't think we've acted quick or fast enough. Unfortunately, we're starting to make some great progress, and we continue to bring down the curve. But in 2018, we were at the point where we had our first decline in drug overdose in nearly 30 years. Unfortunately, we've had a pandemic. Pandemic completely wiped out, and I think it's exacerbated that the issue since then because people were left alone. And people didn't have the ability to go out and do the things that are necessary, so they fall back to their old ways. And we also noticed that with whether you want to call it through the mail or through the border, fentanyl is involved more and more in the system. And it's being pressed into pills, it's being mixed in with heroin, it's becoming more in play in the deaths that are occurring. And it's involved in more American young deaths, especially the drug deaths, than any of the ones before: heroin, meth, cocaine, and prescription drugs combined. In fact, the CDC, fentanyl is involved in more deaths of Americans under 50 than any other cause of death. So it's imperative that Congress acts quickly to protect Americans from the surge of fentanyl that's been pouring into our country, provide support and care for those people who are struggling with addictions.
And that's just the general population at large, honestly. What we're talking about in addition today is looking at those people for a lot of reasons. It could be desperation. We have gone through 2 years of COVID. There's a lot of bleakness out there. And some folks end up wrestling with the criminal justice system, find themselves within it. And I guess, I've talked to people on the Eastern Shore of Maryland where I sometimes reside, and we have detention facilities there, and talking to people in law enforcement about the lack of connectivity they feel they sometimes have with patient care needs, opioid use and treatment and the various dimensions. I just be interested in whether or not you think we need to do more by way of just a platform of support for treating fentanyl and opioid abuse and use disorder in these prisons and whatnot, and in our justice system.
I think it's imperative that we do that because, unfortunately, we found long ago that we abandoned mental health treatment programs and made the jail or the prison system a home for people with mental health issues. So now you take that and you compound it with people who are having drug addiction issues, and a lot of times also part and parcel of a component of mental health issues. So now you've got jailers trying to provide services that are beyond the extent of just housing somebody or incarcerating them or trying to reform them. And if I understand what we were trying to do with incarceration, yes, there's some retribution in having a person incarcerated. We were also supposed to rehab them and then reintroduce them to society. And so the costs that are going on in these jail settings is unfortunately being borne by local counties or state officials. So it's time we started to take some of the resources that we had available and make them available to those jails and allow people to continue, and as you brought up, the connectivity of their services with the actual medicines or the Medicaid or Medicare to make sure that they have the ability to be provided to them while they're in the system. Because I think it's very important that we continue to provide services and help treat these folks, because eventually they're going to get out. And you know what happens is, unlike alcohol or other drugs that have 28 days it was over, then we have to be in a position where we provide some service and help for these folks so they don't go right back into the situation that drove them into the addiction, or the folks that helped drive them into the addiction. So whether it's providing community-based education programs and then providing jobs for these folks when they get out. It's one of the reasons I introduced the Drug-Free Communities program, to give it the flexibility it needs to continue life-saving work among the pandemic, to try to help communities and in prison systems all work together so that they realize that this isn't the 28-day program. It could be 9 months, it could be 2 years. And so we have to all work together and use every arrow in our quiver to try to do that.
Caucus, I know this is unfair. I want to get all the answers from you, but I was really surprised when I did research for today's conversations on the level of incidence inside prisons, and it's high. I mean, somehow the availability, the incidence. What's not as available are the therapies for use and overdose. Now, I think that in schools, we've seen some of the controversies about schools because of young kids, in fact, finding overdosing and having various ways to respond to that, in certain states and communities. What is it going to take to destigmatize the therapies we need, so that whether you're sitting in the justice system, or you're sitting outside the justice system, or you're sitting in a community and you're alone and have issues you're dealing with, that we understand that this is important to help people? It's just sort of a missing part of empathy, I'm thinking, and I want you to fix it for me.
That's a great point you bring up. I participated in a program a few years back about stopping or breaking the stigmatization that goes around opioid addiction, and realize it can happen to anybody in any community. It's not localized to any one area. But secondly, it's similar to what I always say about the mental health area. If you have a broken leg, you get it fixed. You don't continue to do this problem or have the same problem. And we need to destigmatize both the mental health and the drug addiction issues, and start to realize that they were good citizens, they were good people, but for the addiction. And you could realize that when you see these folks. I want to give you a quick example, if you don't mind. It was when I did my time as prosecutor. I'm walking down the street and I see this lady coming towards me. I knew her son just got shipped that afternoon. I figured, well, this is going to be ugly, but it's part of my job. And the lady came up to me and said, "Thank you." Thank you. She said, our son went to a nice university, came home at first year. They were on a family trip in Europe. All of a sudden, the kids started what we would call jonesing, showing signs of the addiction. And they realized that, and he finally admitted that he had an issue and he had tried it. And then he had overdosed a number of times. And I said, "Well, look, ma'am, I don't see your son's name on a lot of these folks. Would be, from breaking and enterings. They'll be on pawn shops lists for pawning things or trying to get the money." She said, "Oh, no. By a week, he was doing fine. He was an apprentice for an electrician." The trouble was that on Friday, he'd go right back and buy what the amounts like he was from the person that he was buying it from, who, was no scientist, obviously. And they would get and take the same amount, but this time it happened to be a lot more fentanyl in it. And she said, "I know when my son's in prison, he's alive. I know that you're at least keeping him alive." Well, that broke my heart. I mean, that's you realize that these are really good families and really good people all over our country that are having the same problem, and they just can't stop it. And because the people purveying it don't give a damn about the person. They're now, as I understand it, pressing pills, make it look like fentanyl. Any way they can distribute their drugs, they don't care. So we have to start. I know people laughed about the old "just say no" thing that Mrs. Reagan had talked about, but it started to tell the kids, like, you don't know what you're taking unless you received it from a physician a prescription that you took to the drugstore and you take it, anything else that comes in a pill form could be deadly. And I think it's important that we continue to drive home that message and allow people to understand that there's no such thing as a safe drug from anybody other than a pharmacy.
Congressman, just finally, if you were to ask the Biden administration to make one big move in this area that they haven't made yet, what would that be?
To get serious about it. I mean, obviously, look, what's happening at our border is atrocious. Let me tell you why. My subcommittee on appropriations is Interior. We have 40% of the border, the southern border. When I went down there and you start to meet with those agents who are talking about it, they were talking about the amount of money that these people are getting to coyotes who are bringing the people over. And, we all know what else takes place. Obviously, this is where you have child sexual trafficking and other things. But they were saying they're getting like $4,000 per person to bring over the border. Now, if you're running drugs and you're doing this, the combination of these two, you're doing nothing to stop the problem. And the problem keeps getting worse. And so eventually you have to say, do I really want to, this is a war on our own children. Do we really want to take the war to them, or are we going to continue to pretend it doesn't exist? And I'm sorry, but there's no other way to look at it. Right. If somebody was sticking poison into our water supplies, wouldn't we do something about it? If somebody was trying to blow up, our situations in the high schools by, giving these drugs out in high schools, which is happening, wouldn't the local people be doing that? Well, why can't we do something nationally about it on a bigger way and fight this as though for exactly what it is, a war on the people in our country?
Well, Representative Dave Joyce, who is the co-chair of the Addiction Treatment and Recovery Caucus and doing so much in this track, really appreciate your time and your thoughts and your stories of why you're doing this. Thanks so much for joining us today.
Thank you all for what you're doing and for bringing shedding some light on the subject.